Hello, this is Melissa from Spinal Cord Injury BC, talking to you a little bit more about different funding sources in British Columbia. In our last presentation, we spoke about different ways that you can earn money, different sources of income in this province and across Canada. We also talked a little bit about ways talk about the funding sources to help you stay healthy and to keep your medical costs as low as possible, again, to help you save a little bit. So think about it. How much do you pay each month or each year for your health? Do you pay Provincial Health premiums, which is your medical services plan, or MSP? Do you pay for prescriptions? Do you pay for equipment such as catheters and insulin, and insulin syringes? Do you pay for physiotherapy? What about vitamins, and can you afford it? What you may not know is there are quite a few ways that you can get this covered, especially if you are somebody who is with the disability or who has a low income. So MSP is the standard BC healthcare plan. Every person in the province must have MSP to see the doctor. If you are an immigrant or moving from out of province, you have a set period of time before you need to apply for MSP, or else you will be charged to see a doctor. So unfortunately, there is a cost. It is $66.50 per person, or $120.50 for couples, or $133 for a family. This is payable monthly. With this, though, it does cover all of your doctor visits, any surgery you might need, blood tests, x-rays, really anything that you might need for your day-to-day help. And on the good side, the positive side is that if you are someone with a low income, you are able to apply for premium assistance. If you are somebody with a medium to high, a moderate to high income, likely that means you are employed, and often your employer will cover these costs, or at least a portion of it. For premium assistance, it is based on your income. So let's look at the table. Let's look at the tables that show how much you can earn and how to apply for benefits. So here are the tables that look at the amount of income. At these levels, this is if your income is from $0 to $22,000 per year, which someone who is receiving PWD benefits would fit under, you don't have to pay anything. Even a family doesn't have to pay anything. The rates are on a scale. The amount you have to pay is on a sliding scale until we get up to $30,000. Anyone who earns over $30,000 will have to pay the full amount. But if you earn around $25,000, you only have to pay just under half of the amount. So that does, just by applying to have part of that coverage, can save you it can save you $30 a month. It can save you even more than that. So it can never hurt to apply. Another part of this is the Fair Pharmacare. That is for people with low incomes to help give you coverage for your prescriptions and any medications you might need. So the coverage from Fair Pharmacare is based on your net income. And even people with higher incomes can get coverage. Even if you earn up to $40,000 or $50,000 a year, if your medical expenses each month are quite high, or each year are very high, you would still qualify for some coverage under Fair Pharmacare. However, if you do have an extended health plan through your employer, you may not qualify for Fair Pharmacare until you go over the maximums allowed under your plan. Though there are many extended health plans that do make you apply for Fair Pharmacare if they find that you are submitting quite a few expenses. So let's look at how to apply online. It is quite a simple process. it isn't difficult for you to apply for Fair Pharmacare. So this is a way that you just go to their website, which is health.gov.bc.ca/pharmacare, and that gives you information on the Pharmacare plan. So all you need to do is go to their website, and you can go to their online registration booth. See, register online. If you've never registered, register online now. And it'll take you through the process and ask you the types of information you'll need. Now let's look a little bit more. Let's find the income percentages. Okay, let's move back to our presentation. The tables are a little bit more difficult to find, but on average, they look at once your expenses reach, even with a high income, once your expenses reach 2% of that of your net income, then you would qualify for Pharmacare. If you earn over $50,000 or $60,000 per year, they would consider 3%. Now, if you are not receiving persons with disabilities benefits, for example, you are receiving old age security or a CPP, you can apply for medical services only, because Fair Pharmacare and premium assistance often are for people receiving persons with disabilities benefits. But you can still get, a lot of people say they're not eligible because they're not receiving PWD, but you can apply for medical services only. Another option, other savings options, once you are registered through MSP, is for your psychiatric medications to be covered. That's called Plan G. If you have any children, BC Healthy Kids helps provide dental coverage and prescriptions for children if their parents are receiving premium assistance, which means someone with a lower income. Now, alternative therapies, such as chiropractor, physiotherapy, and massage, are something that are often covered under employer extended health plans. And many people who are not covered under an employer plan believe that they're not able to see these type of practitioners due to the cost. However, if you do qualify for premium assistance in Fair Pharmacare, you can get coverage for $23 per visit, up to 10 per year, which, while may not be significant, if physiotherapy can help you regain some of your life, and the cost is a barrier, this does help reduce it just a little bit. It gives you enough, it might be enough that allows you to get the treatment that you need. Eye exams are also covered when medically necessary, so you would be required to apply for that coverage prior to attending an exam. You would need information from your doctor about why it's necessary. A very important form of coverage is the health supplement. There is a monthly health supplement from the government on if you have an imminent life-threatening need and you're not receiving other benefits. Again, this is for people who are not receiving persons with disabilities benefits. It's for if you're not receiving monthly nutrition supplement or the vitamin supplement. It's through the Ministry of Social Development. It is for people who are receiving persons with disabilities, but people who are not receiving a nutrition supplement or a vitamin supplement. If you want for details on this, see the help sheet from BC Coalition for People with Disabilities, and it provides a bit more detail. We'll go look at that quickly here. So here is the information on the health supplements for people with disabilities. So if you have a disability, you may be able to access some of these services, but it says you always should apply to the ministry before going through and buying it. So here's who qualifies. People receiving persons with disabilities, if you're a dependent, if you're a single person with persistent multiple barriers, if you're in a household with them. So for all of this information, go to the BC Coalition for People with Disabilities website at bccpd.bc.ca. This is Help Sheet 7. So another option is the monthly nutrition supplement. This is in the amount of $165 and can help you obtain the right food and right supplements you need to improve your health and your lifestyle. Another part of that is a vitamin supplement, which is $40. That can help you buy nutrition and vitamin supplements that you might need to boost your immune system or just improve your overall health if you need to gain some weight. So you cannot receive this supplement if you're under medical services only. You do need to be receiving persons with disabilities benefits. It is required, so family members don't qualify for this. Your weight, or you need to lose weight, or any of these things that your doctor can say, somebody with a spinal cord injury may be able to show that they do have some immune deficiencies or some muscle mass loss that you do need, especially if you're lower income. You need to keep up your strength. You need to keep up what muscle mass you have. You need to keep your weight regulated. So it doesn't hurt to at least apply for this benefit. The monthly nutrition supplement combined with the vitamin supplement adds up to $205 a month. That is $205 that you can spend, that you can save, that it doesn't have to come out of your monthly disability benefit payment. It's $200 towards food that you don't have to use from your spending money. There is also a diet supplement if you're not receiving the above supplements. It's something else you can look into and apply for. Now, moving on from your direct health and diet, a lot of people with spinal cord injuries need a little bit of assistance. So there is funding to have support workers. And I'm sure many people have already heard of the CECL program. And that is a way that to get funding for staff that you manage on your own. You don't need to you get to control who you have in your house. Now the other option, if you're not able to handle having staff, then you can receive a support through home and community care. That is through your local health authority, but they control staffing. They are the ones who will send employees over and determine your needs and the time of day they will arrive. So we will go into this Spinal Cord Injury BC database has a whole section on CECL, which stands for Choices and Supports for Independent Living. So here's our guide that just walks you through what you need to do, and please call. If you do have questions on how home and community care works, you should contact your local health authority and you will be assigned a case manager or caseworker or social worker to help you through the process. Now, as you're aging, there are additional services for seniors. There is a seniors health support line that you can access. And after age 65, when you don't have PWD, when you are receiving federal benefits instead of provincial, you still can get the medical services only. That is still an option that you can apply for, especially if your income is below $1,000 a month. So there is a website that is for BC, for the services in BC for seniors. So let me show you this website. There's quite a number of different resources and a lot of information that can just help you live a more comfortable life. So it includes housing options, home and community care, and health and safety, and ways to live the healthiest active life possible. In conclusion, many medical expenses and nutritional needs can be covered. Equipment is often the most expensive thing needed, and it can be a little bit more difficult to get coverage for that and to get funding for that. But it is available. There are ways, especially you can get funding for your prescriptions and funding for any things you need, such as insulin and needles for insulin and catheters. No, catheters are not often covered under the provincial benefits. There are some ways that you can look into that, but again, contact the Ministry of Social Development and talk to your caseworker about those things. So seniors have coverage under the medical services plan just like everyone else in BC. They do qualify for fee reductions, the monthly premium reductions, and fair Pharmacare. The BC government wants to ensure that everybody is as healthy as possible and will make sure it will not provide barriers to seeing a doctor. So for more tips on saving, see our other videos, or contact the peer program to talk with somebody about their experiences with medical plans.